Which salivary gland develop first and which develop last, and which salivary gland last to encapsulated? To searching these answer, we have to go into development and embryogenesis of the salivary glands. The salivary glands share a common embryological development, whether they are major or minor, all develop from common embryological development. The major salivary gland develop from the 6th to 8th week of gestation as outpouching of the ectoderm into the mesenchyme. Parotid develop first, growing in the posterior direction, and where facial nerve going into the anterior direction. So ultimately, parotid gland surround the facial nerve. After the parotid development, submandibular gland start developing at 6th week and sublingual gland develop at the 8th week, where tuberous gland develop at last about 11th week of gestation. The minor salivary gland arises from oral ectoderm and nasopharyngeal ectoderm, and ultimately they invade into the submucosal plane. While the parotid is the first to develop, it is last to become encapsulated after the lymphatic development. This results in entrapment of lymphatic deep to the capsule in the parenchyma of the parotid gland, ultimately leading to Wharton tumors, which is common site is the parotid. So salivary epithelial cells can be included within these lymph nodes, and this entrapment of these lymphoepithelial cysts leading to Wharton tumor formation in the parotid, which is last to encapsulated. These submandibular glands in general become encapsulated before the lymphogenesis and usually do not have any intraparenchymal lymph nodes. So this submandibular gland encapsulated before the lymphatic development, so there will be no intraparenchymal lymph node and there is no Wharton tumor in the submandibular gland. The major glands lies distal to the oral mucosa and connected to the mucosa by excretory duct. The minor gland lies within the mucosa or submucosa of oral cavity and oropharynx and open directly into the surface, which are located into the mucosa or submucosa by the short excretory duct. The microscopic anatomy. Salivary glands are made up of secretory acini and ducts. The acini can either be serous, mucus, and mixture of serous and mucus. The secretory cells are categorized into three types: serous, mucin producing, and seromucin producing cells. The acinar duct coalesce into the intercalated duct and subsequent striated duct composed of columnar cells and ultimately form the major excretory duct of the gland. The intercalated duct are lined by simple low cuboidal epithelium and surrounded by myoepithelial cells. The striated duct have a folded basal membrane, enabling the active transport of substance out of the duct, such as water absorption and active secretion to the ducts. The excretory ducts are lined with the tall columnar epithelium. Within the major salivary gland, the acini are arranged into lobules and lobes within the glands. Each lobule have a secretory duct. The lobule are linked by dense fibrous tissue containing excretory duct, vessels and lymphatic nerve fiber and ganglia to the lobes. So these morphological features are important to know. So parotid gland weight about 25 gram, submandibular gland weight about 10 gram, and sublingual gland having weight approximately 5 gram. Ducts are: parotid duct is called Stenson's duct, 5 centimeter, 3 mm diameter. Submandibular gland duct is called Wharton's duct, 5 centimeter, 1.5 mm diameter. And sublingual gland duct is called ducts of rivinus, and they are very small in size, short in, and diameter is about 0.6 mm.